Journey Through Parenthood with Martina Bills.
Brought to you by Southern Ohio Medical Center. Very good things are happening here.
Good Monday morning, everyone. I'm Martina Bills. Thanks for joining us here on the WSAZ Now Desk for Journey Through Parenthood. Today's topic is all about dad. It was Father's Day last week, and the month of June is really set aside to raise awareness about men's health. And sometimes, the men are the ones in the home who kind of neglect making sure those appointments are yearly and they're scheduled and make sure all their ducks are in a row when it comes to health.
I think that really it boils down to making small changes and being consistent with those over time. I think that oftentimes we have in mind that it's got to be something that is elaborate or impressive from the beginning. And I think that the gains are really there if we're just willing to consistently make an effort and consistently improve our outcomes.
Mm-hmm. And talk about what that consistency really should include. Is this all about, a healthy lifestyle, whether it's the food you eat and the exercise that you get to kind of take it as a whole?
Sure. So I think that a lot of this it's very basic. It's trying to have a consistent schedule. It's trying to go to bed at a consistent time and get up at a consistent time whenever you're able. I think that we are made to where we feel best when we're eating natural foods, eating produce and fiber and lean proteins, things that are not overly processed. I think that we feel best when we are active on a daily basis. And that can look like so many different things. There's so many different ways we can exercise or find that activity. Yes to all of those things you suggested. It's diet, it's exercise, it's schedule and routine. And I think sometimes, again, we can put this pressure on us for perfection, but I think we just need to make those small incremental changes and try to stick to those small changes over time.
And I think that that speaks volumes for everyone, male or female, no matter what you're talking about with lifestyle changes, because sometimes people go at it too strong at the beginning and kind of, lose momentum because it's so much. And it doesn't have to be putting a huge change in your life.
I agree. And sometimes we hesitate to start because we feel like something's not going to be perfect. Maybe we feel like, well, I'm not going to exercise at this time today because I'm usually not going to be available at this time. Or maybe I don't have the perfect shoes or I don't have the right routine in place. And I think we just need to think of it one day at a time. And how can I be active today? And maybe you've got a time window you don't normally have or an invitation from somebody that's out of the blue. I think we just have to take advantage of that on a daily basis.
Mm-hmm. And I know that sometimes when people start thinking about eating healthier, it can be, a burden to think about or overwhelming. But you were mentioning, eating those normal, healthy, whole foods like fruits and vegetables and adding some of those can really make a difference. It doesn't have to be this extravagant diet, so to speak.
Absolutely. We can very often improve our diets by making one change at a time. We can say, I think I can order something that was natural instead of processed. We can change what our grocery order looks like and take some control at that level. A big thing is we can commit to drinking water instead of other things, and that can have a tremendous impact. And I think a lot of times we underestimate the impact we can have just with starting to track our calories and to be aware of how much am I taking. And that's something that can start to have an impact without us even changing those habits yet. It's just becoming numerically aware of our habits.
Mm-hmm. Dr. Allen, what about seeing a health professional on a regular basis for men? Because I know, when you have kids, those kids never miss those yearly appointments and checkups. And if they're sick, they're at the doctor. But what about for a man who may be, really busy, his work schedule doesn't really allow him to make much time for something. But how important really is it to make sure they do see a doctor on a regular basis?
That's a great question, and I will often frame that for my patients in the context of think about how essential and valuable you are to your family and that that role that these patients and that men often, and women for that matter, fill in a family, it can really be irreplaceable. And so I think it's important for that reason. I think it makes sense to be seeing the physician at least annually, and to talk about fitness, to talk about weight, to talk about diet and exercise and energy levels and these things. Based on medical conditions, it may be that that recommendation would be for more frequent visits if there's a plan that's being put in place to improve health, or if there's some underlying comorbid medical conditions that need closer monitoring. But yes, I think there is some value to that. And I think that even in the absence of other quote unquote medical problems, I think that at that annual visit, the provider is going to be looking for things that we might not look for on our own. Going to be looking for things like blood pressure or changes in weight, changes in mood that could be impacting overall health, or could be signs of other things going on medically.
And I know, you often hear some people say, I haven't been to the doctor in so long, I'm fine, or I haven't been to the doctor in so long and I really don't want to hear what they have to say. But also those two things go into play with what you were saying, that really think about your role with your family and how important you are to those maybe children and a wife or a spouse, so to speak.
I think you're absolutely right. If we are considering our health as something that we take seriously, not just for our own sakes, but for the sake and the benefit of the people we care about, I think that can be a powerful motivator.
So Dr. Ben Allen with Valley Health Systems, he's family medicine. Over at Valley Health, a lot of good information, but he says when it comes to your health as a man, maybe the father in the home. And if you're not a father, this just, is talking about men in general. With Father's Day last week, we kind of are raising awareness for men this month. We always focus so much on women's health. It's time to give the men's health a spotlight, but consistency is key when it comes to eating right, making sure you're active, whether it's the same exercise every day or just starting small. It doesn't have to be a big thing, and not to think about it too much. Just do something to get yourself moving. Consistency is key, Dr. Allen says. So definitely, he said sometimes people hesitate to start a new exercise regimen or eating more healthy, but he says every little bit helps, and less processed foods, more natural foods is always the way to go for a healthier lifestyle diet-wise. So a lot of good information from Dr. Ben Allen. We appreciate him talking to us here on Journey Through Parenthood. And if you ever want to reach out to me, you can find me on social media. You can always reach out to me there, or give me a call here in the newsroom, or email, or just send me a message on one of those social media platforms. We're here every Monday and Wednesday on the WSAZ Now desk at 10 o'clock. We hope you have a great Monday.